Dr. Melnick, let's talk about the people who have fear from dentistry and would love to sleep through it, and maybe people who need a tremendous amount of work done and can't keep their mouth open for long enough. And there seems to be something which actually does put them to sleep, and I think you're doing it. Tell us about it.
Well, Helmut, there are virtually millions of people that avoid the dentist because of fear. Yeah. Somewhere along the way, they've been mistreated. Maybe they were hard to numb. Whatever reason, they've stopped going to the dentist on a regular basis. And we've talked about why that's not good, not only for their mouth, but how that can affect the rest of the body. Right. Well, dentistry has worked hard at finding ways to reach out to those people, and one of the techniques that we use is something called oral conscious sedation. By simply giving people pills, either ground up and they mix with a little water and they swallow it, or ground up and put under the tongue, people can literally relax their way to having their mouth fixed. Now, there's different levels of anesthesia, and we're not giving them general anesthesia like in an operating room, quite simply because when we fix your teeth, we need you to be able to bite together to make sure your teeth still fit together. So there are times that we're going to need you to be able to open, to be able to close, things like that. So we want to relax someone, but not to the level that they're unresponsive. And that's why it's called conscious sedation. Mm-hmm. So we literally give people pills. They sit for about 45 minutes to an hour. We come back, we, talk to them, ask them how they're feeling, and either we begin treatment or we give them another dose. But the purpose of the pills is to give them a sense of calm and relaxation. They lose sight of time. They will fall asleep at times during the treatment. But if we need them to respond to commands, we can call out their name, lightly tap them on the shoulder and say, Joe, please bite down or open or grind, whatever we need them to do. And I'll tell you, we've been doing this now for several years. Both Dr. Miles and I are hospital-trained dentists, so we used to do IV cases, we used to do hospital cases, but here in private practice, we are so thrilled with this technique because it's safe, it's effective, and it has now allowed us to expand our services to a large segment of society that's been avoiding dental care. And I'll tell you, these people appreciate this service. We haven't had a case that we haven't been able to finish to completion. Patients just love getting this done. We can do a lot of treatment in one, sometimes two visits, so people don't have to come back and forth 8 or 9 times. It's a beautiful way to get your dentistry done. And there's one more nice thing about it. The drugs that we use cause what's called retroamnesia, meaning tomorrow they're not going to remember 90% of what we did the day before. Wow. While they're in the chair, it's a safe environment. We work with them as a partner. We work together to make sure they're as comfortable as they can be. It truly is a marvel of modern dentistry.
Incredible. Yeah, I mean, technology has made its way in all phases of dentistry in it, as we keep noticing. And so, I mean, even though most of the fear most of us patients have is not quite anymore as justified, and some of it didn't come necessarily because of bad experience of a bad dentist. It's just, I do remember when I was I would say about 17, 18, 19 years old, the needle the doctor stuck into it, I mean, it was like a plumbing pipe. It was huge. I mean, it was like short with a big diameter of hole, and he put it right straight 90 degree into the gum, and I mean, that thing was hurting more. I think would have been better to just pull the thing without an injection. Even though that doesn't happen anymore today, people still have the fear. And then there's the fact, I don't think you mentioned it, like some people, like all people, they don't necessarily, if they have lots of work, want to go 9 times to the dentist. And with this thing, you can do tremendous amount of more work. You can finish 5, 6, 10 teeth in one shot. And yes, the guy's afternoon is shut and done, but that's nothing compared to, it's usually shut anyway by the time you go to the dentist, by the time you come back, have to take off of work. So if you can stay there 3 hours longer and can stand it, that must be a big advantage, right?
Well, yes, that's true. But another thing that neither one of us mentioned was there are patients that are in the category, Doc, nobody can get me numb. I'm hard to numb.
Oh.
And sedation dentistry is a godsend for these patients because under sedation, getting them numb is much, much easier.
Wow. All right, so sedation dentistry, here you have it. So you kind of sleep through it, but you don't. You're still awake. You still can go to the bathroom if you want to, I guess. I don't know, you know.
Yes, you can. Absolutely.
Wonderful. You can still tell the dentist to whatever, say, hey, smile, you know, I feel lonely down here. And at the same time, next day, you kind of don't know what's going on. You know, seems to be being...
No, the next day you'll be clear-headed. You won't remember what you don't want to remember from the day before.
Sounds like going on a trip.
Most people who have been avoiding dentistry don't want to think about it.
Right. Sounds like going to on a drinking binge without the hangover. All right, Dr. Melnick. Bye-bye.